Facial numbness, facial weakness. You smile and your smile is uneven, or slurred speech. Any of those symptoms should prompt you to call 911 right away. Don't ever blow those symptoms off. Guys, we're talking about the warning signs of stroke today. This is really important to me as a family doctor. Over the years, I've occasionally seen a patient who has had symptoms of stroke but didn't think that that's what it was, or blew it off and attributed it to something else. The symptoms I'm going to mention, guys, are some that you should never, ever blow off. The first being what I mentioned: sudden facial drooping, numbness of your face, a smile that's uneven, slurred speech. Also, arm weakness. If you have someone who has a stroke raise their arms up, they might, okay, if they have arm involvement, have one arm that kind of drifts down or is not able to stay up, okay? Arm weakness, arm numbness, arm tingling, any of that that's sudden could indicate a stroke. Also, I mentioned speech difficulties when I was talking about the facial symptoms that people can get. So slurred speech, just sort of not talking in a garbled way, or not talking the way they usually do. But there are other symptoms as well, and I would say those are some of the sort of big signs and symptoms, but there are other ones, not just those. Numbness or weakness really in any part of the body, okay? Not just the arms necessarily. It can be other parts of the body where you get numbness or weakness. Also confusion. Sometimes people with stroke symptoms simply get confused all of a sudden, are not able to recognize someone, not able to speak properly, not able to comprehend or understand what they're hearing, or simply confused in general. Sudden confusion of any kind, whether you're worried about a stroke or not, should send you to the hospital, prompt you to call 911, okay? Trouble seeing, if you lose vision, vision problems in one or both eyes, that's a problem. And also trouble walking. Let's say, your walking is normally fine, but all of a sudden you're having balance problems. You're having problems with your gait. You're having problems with your coordination. You're having problems with walking. That is absolutely a concern. Also, things like severe headache, an unusually severe headache should prompt you to seek medical care right away. And I would argue that there are still symptoms even outside of this second bubble that I sort of mentioned. The idea, and I've often said this before, guys, is that if you notice any unusual symptoms ever, it should always prompt you to seek medical care. But any of the ones I just mentioned here and some others can signal a stroke, and this is potentially life-threatening, and that's why you don't want to wait and you don't want to blow it off. There's a couple of different types of stroke. There's ischemic strokes. That's when a blood clot blocks a blood vessel or an artery in the brain. That's most of the strokes that we see. We also see hemorrhagic strokes. That's when a blood vessel bursts and causes bleeding into the brain. That's less common, but it does occur as well. I'll probably do another video on the risk factors for stroke, but just a brief sort of primer about that. High blood pressure, atrial fibrillation, smoking, diabetes, sickle cell disease, high cholesterol, a family history of stroke. There are many others which I will do another video on, but just understand knowing your risk factors for stroke is going to be very important, so talk to your doctor about that. Know the warning signs, guys. If any of those signs or symptoms ever happen to you, or others that seem unusual or you are worried about, you call 911, you get medical care right away. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I hope this is helpful. Guys, for those of you who are on YouTube, thank you so much for watching. Please subscribe to my channel and click the little bell for updates. And on both sites, I have subscription groups. I have my Dr. Jen Superstars group on Facebook. We have exclusive content. Guys, I'm Dr. Jen. Stay safe. I'll see you soon.